Ano nga ba yung kailangan nating malaman in order for us to be informed about the vaccine? We have to remember that this vaccination has to be a personal choice. May tinatawag po tayong informed consent. And as mentioned kanina, meron pa pong hindi sumasagot sa inyong survey kung sino po ang gustong magpabakuna at hindi, or anong klase ng bakuna po ang inyong gusto. Maybe you are just waiting for the information to be given to you para po kayo magkaroon ng informed consent. And I hope that this discussion will help you choose to be vaccinated or not, kasi hindi po natin kayo pipilitin. But of course, if you have the correct information, dun po tayo magbe-base kung ano yung magiging decision po natin if magpapabakuna po tayo or hindi. So my topic for today is entitled COVID-19 Vaccine Program, 10 Must-Knows for Everyone. Here are the objectives of this discussion. By the end of this module, you should be able to enumerate the objectives of the COVID-19 vaccine deployment and vaccination program and respond with accurate answers to the 10 COVID-19 vaccine must-knows. Una, bakit ko kailangan magpabakuna? Why do we need to get vaccinated? Which vaccines will we use and how are they selected? So malalaman po natin yung process. Libre po ba ang bakuna? Sino ang unang mababakunahan? And kailan po ba yung turn ko na mabakunahan? What do I do bago po ako mabakunahan, during and after vaccination? And ito po yung isa sa common na tinatanong, if I get vaccinated, can I already stop wearing face masks, face shield, regular hand washing, and practicing social distancing? And last, how do I make sure that the vaccine I get is authentic? So these are the things that we need to learn for today. So first, of course, our general objective is to help save lives and mitigate the impact of the COVID-19 pandemic. Nakita na po natin, it has been years or more than a year that we are battling with this pandemic, and we have seen the cases rise not only in Tuguegarao City but in the entire region and in our country. So specifically, the launching of the National Vaccination Program against COVID-19 and to provide a free and effective, high-quality vaccines against SARS-CoV-2, and we prioritize those who are at risk or yung tinatawag nating vulnerable population. So ito po yung pinakauna nating tanong, why do we need to get vaccinated? Very important question that we really need to accurately understand the answer to it. So kailangan natin malaman, ano po ba yung benefit ng pagpapabakuna? So unang-una po, I know na hindi naman po ito yung first time na nakapagpabakuna tayo, pati mga anak natin, napabakunahan na po natin. So unang-una na benepisyo po ng vaccine is to prevent symptomatic infection. Ibig po sabihin, meron pa rin pong chance for others to be infected, but they will no longer be symptomatic. Pangalawa po, which is the very important benefit, another very important benefit, which is to prevent severe infection. So, okay lang if, for example, magkaroon tayo ng regular flu-like symptoms because that is bearable. Okay lang yan kasi after a few days, mawawala na siya. But what we really want to prevent is to have a severe or critical infection which will require us to be admitted in intensive care unit, or baka mag-require po na ma-intubate or matubuhan po tayo at may kabit sa mechanical ventilator to help us breathe. These are the things that we want to prevent. And of course, if we are vaccinated, we will be able to lessen the transmission to other people. So paano nga po natin ma-achieve yung benefit niya to prevent transmission? We have what we call herd immunity. When we say herd immunity, di ba parang herd, parang sama-sama po, it's like a flock. Meaning that majority of the population needs to be vaccinated for us to achieve herd immunity. Meaning at least 70% of the population. So if there are 100,000 community people, at least 70,000 should be vaccinated. Ano yung impact nun? Ang impact niya is that even the last 30% of the population, kahit hindi po sila mabakunahan, they will already be protected because of this herd immunity. Kasi po parang magiging harang na po, magiging barrier na po yung mga ating nabakunahan from transmitting it to other people. So ito po yung tinatawag nating herd immunity. Now, Another very important concept that we have to learn about vaccination is the term immunogenicity. What does it mean? So this is the ability of the vaccine to elicit a measurable immune response. This is the most important statement here. Sabi niya, you develop the same immunity without actually getting sick. Diba? Magkakaroon tayo ng immunity pero hindi natin kailangan ma-experience yung sakit. So let's look at this first picture A. So as we can see here that person actually had the infection, nagkasakit po siya. So you can see the viral load increase in the body of the patient. So ito yung tinatawag nating infectious agent. The infectious agent particularly is the COVID-19 virus. It's a virus. And another term would be, tinatawag din natin itong antigen. Sa madaling salita, kalaban ng katawan natin. So when there is an infection, this viral load will increase in our body. So makikita natin ano ang response ng katawan. Of course, it will depend kung kung mataas or maganda ang immune response ng katawan. Ibig sabihin, wala siyang ibang existing na sakit, hindi siya immunocompromised or mababa ang immune system. So halimbawa, we're talking of a normal person. So the T cells will increase. Ano ba tong T cells na to? Ito ay kasama sa ating immune response. Sa madaling salita, ito po yung panlaban niya sa antigen. So it will increase. But after the infection, it will decrease, it will go down again. So, kasi nga lalabanan niya yung current infection. Now, let's talk about the antibodies. Ito po yung panlaban natin sa antigen. So, tataas po ang level ng antibodies natin. Nag-develop siya ng antibodies and it will maintain a certain level. Ngayon, halimbawa po, nagkaroon ulit ng same na sakit yung person, COVID-19. Pwede ba tayo magkaroon ng reinfection? Pwede po, dahil meron po tayong iba't ibang variants ng COVID. So, nagkaroon ulit siya ng second infection. Now, on the second infection, it did not already allow the viral load to increase such as the first one because we already have existing antibodies to fight the virus. So these existing antibodies will not allow this viral infection to already cause disease. So ito po yung line ng disease, no? Pag tumaas po siya higher than that, magkakaroon po ng symptoms yung pasyente natin. No. Now, even if we had that second infection, since we already have these antibodies, it will not already allow it to cause disease. So tataas po ulit yung level ng antibodies natin because of that secondary infection, as well as the level of our T cells, which is also involved in immune response. So itong first picture shows us what happens if we get sick. Now, what if we get vaccinated? Do we get the same immunity without actually getting sick? So tingnan po natin. Now, we get vaccinated. So nagpabakuna po tayo for COVID. So makikita natin that it did not reach the threshold wherein it will manifest as a disease or magkakaroon ng sakit yung tao. Now, makikita po natin when you get vaccinated, you will develop the same immunity that a person who got COVID developed. So, nagkaroon din po ba siya ng increase sa T cells response? Yes. Nagkaroon din po ba siya ng increase antibody level? Yes. So, when the time comes na magkaroon po siya ng exposure sa isang, for example, patient with COVID, they will get the infection, but as you can see, it will not reach the threshold of causing the disease. And also, you will have an immune response to that. Tataas ulit yung antibodies and the T cells will also respond. So this is what we call immunogenicity. You will develop the same immunity without actually getting sick or without the need of getting sick para lang makuha mo yung antibodies po na yun. So that is vaccination. Now, next question is, which vaccines are we going to use in our country? So we have the following: AstraZeneca, Gamaleya, Janssen, Moderna, Novavax, Pfizer, and Sinovac. This has been studied. Nagkaroon po ng review about these different vaccines, not only by the Food and Drug Administration of the Philippines, but by the independent experts as well. So let's have a quick look at the different vaccines and how they differ. So as we can see, andito po yung mga names po nila. There is a technology platform na tinatawag. Ibig lang po sabihin nito, anong klase or part ng virus ang kinuha natin para gawin na component ng vaccine na to. Let's take note po that our vaccine actually contains some part of the virus. Pero hindi po yung buong virus, and at the same time, it is inactivated or patay na po yung part ng virus na ito. So for example, for Pfizer-BioNTech as well as Moderna, they use the mRNA of the virus. For Sinovac, they use an inactivated virus. Ibig sabihin, patay po siya ng virus as well as biotech. So yan po ang mga different technology platform. So this is also the following dates wherein FDA approval has been given to the said vaccines. And as we can notice here, sa dosage and frequency, majority are given into 2 doses except for Janssen, no 1 dose lang siya. And you can see po, magkakaiba po yung interval po nila. Kasi yung iba po, sometimes they compare AstraZeneca with Sinovac. As you can see for AstraZeneca, it is up to a maximum of 12 weeks apart. It is given to a maximum of 12 weeks apart, while for Sinovac, it is 28 days apart. So shorter yung duration. If we look at Pfizer, 21 days apart po siya, and the shortest actually is the biotech, which is 14 days apart. So there are also different storage requirements. Napakinggan ko po kanina, majority po gusto ng vaccine na Pfizer. So marami pong may gusto ng vaccine na Pfizer. But when we look at the storage requirements of Pfizer, it is at -80 to -60 degrees Celsius, meaning it requires an ultra-low freezer in order for us to be able to store it and maintain its efficacy and effectiveness. While that of AstraZeneca and Sinovac, which is yung talagang ginagamit po natin ngayon, it only requires a 2 to 8 degrees Celsius, or sa madaling salita, yung regular freezer po natin sa bahay, pwede or kaya niya na pong i-store ang Sinovac and AstraZeneca. And with this, makikita po natin why these are the first 2 vaccines that were made readily available for us. Kasi po dito sa ating rehiyon, hindi po lahat merong ultra-low freezer. Sa katunayan, kakunti lang po ang nagkaroon ng access ng ating ultra-low freezer. So for vaccine efficacy based on phase 3 clinical trial, so makikita po natin magkakaiba po yung percentage nila. But what I want to emphasize here, for example, for Pfizer, kasi ito po yung isang tinitingnan ng mga namimili ng vaccine. So sabi po niya dito, it is 95% against symptomatic COVID-19. Mataas yung efficacy rate niya both for mild and severe cases. Actually, 100% against po siya against severe COVID cases. If we look at AstraZeneca, it is 70.4% efficacious against symptomatic COVID-19 or yung mild case natin. But if we look at for severe case, it is 100% against the severe COVID-19. Ibig po sabihin, kahit na po slightly lower siya than that of the mild case, pareho lang po sila ng Pfizer that can prevent 100% prevent severe COVID-19 infection. Meaning, ano ba yung gusto nating iwasan? Ayaw natin magkaroon ng severe or critical case ng COVID. Kung mild yan or asymptomatic ka, okay lang because it's just like a regular flu. Pero ang gusto natin maiwasan po is the 100% severity. As well as for Sinovac, it has 65 to 91% against mild cases, but it has 100% efficacy against severe cases. So it goes on for the other vaccines. And there are adverse effects reported which are observed in phase 3 clinical trial. And ang pinaka-common po dito, short term, is the mild to moderate pain at the injection site, fatigue, and headache. So ito po yung mga pinaka-common. But in our COVID-19 vaccination program in our region, only less than 1% of the vaccinated population has developed adverse events following immunization. So mababa po. All right. So, who are the expert groups and what do they do? So, gusto natin malaman, sino ba yung nagsabi or nag-approve ng emergency use authorization? So, we have what we call our VEP, our vaccines expert panel. So, they will answer the question, should the government allow clinical trials or should we consider it? We also have the Philippine FDA. So, sasagutin pa nila yung tanong, is it safe and efficacious? And do the benefits outweigh the risk? We also have our Health Technology Assessment Council, or HTAC. They will be the one to answer the question if the government should buy the vaccine. We also have our National Immunization Technical Advisory Group, or yung tinatawag nating NITAG. Okay, they answer the question, how should it be delivered to the people? So making sure that the vaccines will be equitably given to people and delivered on time para maiwasan din po yung ating pagkakaroon ng ating wastage ng vaccine. And National Adverse Events Following Immunization Committee, NAFIC, ito po very important. I would like to emphasize about this. So in our country, there is a national committee who will be monitoring the adverse events following immunization. And also on our region, at lahat po ng region ay nagkaroon din po ng creation ng tinatawag na RAFIC, or Regional Adverse Events Following Immunization Committee. So if there are adverse events, they will be the one to determine if it is caused by the vaccine. So for our serious adverse events following immunization, our RAFIC, in coordination with the NAFIC, has already conducted meetings to check if the causality, if it is being caused by the vaccine or not. So for vaccine development and approval, ang mga vaccines, may mga nagsasabi po na mabilisan siyang ginawa. But actually, we have what we call the phases of clinical trial, wherein you cannot move on to the next phase without completing or being able to complete the requirements of each stage. So we have a preclinical trial wherein animal studies are being conducted. If it has been seen to pass the animal studies, then it will move on to the clinical phase, wherein in this clinical trial, meron po tayong phase 1, phase 2, and phase 3 initially. So sa phase 1, it will be tested on 10 to 100 individuals to check the safety versus those studies in humans. So sa tao na po siya tinetest. And then sa phase 2 clinical trial is 100 to 1,000 individuals to check for its safety and initial efficacy in larger population. While in phase 3 clinical trial, it will be for thousands of individuals, up to 30,000, to check for the efficacy and long-term safety in large-scale population. So we're going to ask, is it safe and efficacious? Upon answering this, ang next na tatanungin natin, do the benefits outweigh the risk? So we have seen our country, and not only our country, but the entire world, suffer from this pandemic. Madami pong nawalan ng trabaho, nawalan po ng kapamilya, ng buhay, nagkasakit, financially naapektuhan. So titignan natin, do the benefit of having the vaccine now outweigh this risk? Upon answering this, susunod na po dito yung tinatawag nating emergency use authorization, which is given by the FDA. So based on review of the interim data from half of the target population of phase 3 trials, plus emergency which justifies its use in emergency. So meron ba tayong existing emergency? Yes, we have this pandemic right now. And if the vaccine is already has been seen to be efficacious, and that the benefit outweigh authorization. So certificate of product registration will also be given based on review of complete data from phase 3. So this will be given. Now, next is, do we have to pay for anything? Is it free? So I think since we are in the government, alam po natin that this is 100% free. Wala po tayong babayaran. This is, what are the goals of prioritizing and who gets the vaccine first? Diba? Parang niisip po kasi natin, since kakaunti po yung vaccines na available or limited pa lang po yung vaccines na available natin, we have to set the goal in order for us to know who to prioritize. So what is the primary goal of our government? First is the maintenance of most critical essential services. So we have to be able to provide the essential services to our community. Thereby, we have to protect our frontline healthcare workers first, since sila po ang nag-aalaga directly ng ating COVID-positive cases. And the next primary goal is the direct reduction of morbidity and mortality. We would like to decrease our morbidity as more especially our mortality rates. So what did we do? We prioritized those vulnerable groups. And sino yung mga kabilang dito? We have our senior citizens and people with comorbidity. So sila po ito po yung primary goal. Secondary goal is to substantially control the transmission and minimize disruption of social, economic, and security functions. Gusto na po natin bumalik sa dati because a lot has been affected already. Marami pong nawalan ng trabaho. And our tertiary goal, which is the goal of everyone, is to go back to at least near normal. Now, with this goal, dito na po na base ang ating priority group. So nakita po natin nung unang nagkaroon ng vaccine, we started with vaccinating our frontline health workers, followed by our indigent senior citizens, remaining senior citizens, remaining indigent population, and uniformed personnel. Actually, ito po ay ating people with comorbidities already. So for frontline healthcare workers from the public and private sector currently on active practice, whether they are permanent, contractual, or job order employees or staff. So yung mga medical centers, hospitals, clinics, TTMF, and treatment rehabilitation centers, sila po yung mga nauna. This is followed by public health workers such as in public primary care facilities sa RHU, City Health Office, whether LGU hired or DOH hired po sila or deployed sa ating PHOs, Centers for Health Development, DOH and attached agencies, LGU deployed, hired or designated contact tracers with appropriate documents stating deployment or designation as contact tracers. Also, we have included our barangay health workers who are in active service as well as our BHERTs, Barangay Health Emergency Response Teams. So ito po, since we are with the DILG, ang ating mga BHERTs, meron din po kasi tayong na-encounter na nagkakaroon po tayo ng difficulty also in having them vaccinated kasi may mga areas po na they are not willing to be vaccinated. So we hope that with this discussion also, we can also convince but inform them about vaccination and help them decide to be protected as well. So, ayan, other national government agencies, DSWD, DILG, sa DSWD, all employees manning closed-setting facilities and long-term facilities such as orphanages, home for the aged, women's crisis centers, social workers providing social amelioration and social services in the communities, DILG hired contact tracers, BJMP and Bureau of Correction, all employees and health workers assigned in direct contact with PDLs, as well as jail officers, wardens, and guards. Okay, so for priority group B, we have our teachers, social workers, other government workers, other essential workers outside health, education, social welfare sectors, socio-demographic groups, overseas Filipinos, and other remaining workforce. So we also have our priority eligible group C, all remaining Filipino citizens. Sa vaccination procedure, marami po ding nagtatanong, meron po kasi akong high blood or diabetes or asthma or cancer, pwede po ba akong mabakunahan? So as I mentioned kanina, one of our priority group, which is considered as our vulnerable group, are our people with comorbidity. And since sila po ang priority to be vaccinated, there will be screening that will be conducted in order to make sure that during that time, stable po sila. So pagdating po sa vaccination, una magre-register po tayo. Meron po itong pila at nakaschedule po para wala po tayong tinatawag natin yung maraming tao sa isang area. So pre-vaccination counseling will be done and final consent. Pipirma po tayo. Ito yung tinatawag nating informed consent, meaning we are willing to be vaccinated and we know the risks and benefits of the vaccine. After that po, hindi po agad babakunahan. I-screen muna po ito ng ating medical team. I-check po ang ating vital signs at meron po tayong sasagutan ng mga katanungan to check if we are eligible to receive the vaccine or not. And if we are, then we will proceed to the vaccination proper. So very important also to take note that we have a composite team which is composed of our surveillance officer, as well as our medical team to monitor post-vaccination. So the patient will be observed for 30 minutes to 1 hour to check for any reaction. And there is a standby medical team po to address in case po na magkaroon po tayo ng reaction, intervene with the symptoms of the patient. Next is to monitor vital signs every 15 minutes. And to respond and give first aid to patients with reactions. And if kailangan po talagang i-refer sa hospital, then the patient will be referred to hospital for further management. Okay. Next, when and where will I get vaccinated? So in partnership with our LGUs to get the vaccines for you, the LGU will arrange for the registration and scheduling of vaccination as well as identifying vaccination sites. We just have to wait for the instruction or announcements from our mayor or governor. But for us in our region, we have already started vaccinating in our office, the different employees of our national government agencies who are under the priority groups. So DOH with LGUs will implement electronic immunization registry in sites following priority eligible groups. So magkakaroon po tayo ng master list uploading in our registry. And they will be identifying implementing units in the area. So ito po yung tinatawag nating fixed post-vaccination strategy. So ito po yung in-identify natin in order to also protect our healthcare workers as well as our vaccinees. So fixed post po siya, either sa hospital po, infirmaries, rural health units, health facilities of other government agencies, and private clinics. So may mga fixed post po kung saan po pupunta ang ating mga vaccinees. So what do I need to do before vaccination? First, make sure you obtain accurate information from the right sources or experts who are licensed professionals, and always verify what you read and hear from others. Actually po, this is also a challenge I am experiencing with my family. Ang aking parents po, may mga nababasa po sila ng mga information in the internet, and sometimes it is presented in a way na mukha po siyang legitimate. So ang hirap po mag-explain po ulit sa kanila kapag lalo na very convincing yung article na nabasa po nila. So we have to make sure that we read the right sources. Okay, on your scheduled health screening, declare your complete medical history. This is important to determine which vaccines are appropriate for you. So no person will be scheduled for vaccination without going through health screening. Ito po yung in-emphasize natin. Kasi sometimes kapag hindi natin ginawa itong health screening na to at binakunahan po natin, doon po tayo magkakaroon ng problema. So if we will not be able to identify na may existing po pala silang meron po silang simptomas, o kaya may exposure po pala sila sa COVID case pero agad po natin binakunahan, hindi po dumaan sa proper health screening, magkakaroon po tayo ng problem kapag ganun po ang nangyari. It may cause symptoms after which na hindi naman po related with the vaccine but will appear to be related with the vaccine because of inappropriate or incomplete health screening. So when will the vaccines arrive and how do we get them? So base case scenarios that vaccine arrives on. So alam naman na po natin, no, dumating po siya this first quarter of 2021. And there are different master listing and scheduling of vaccination following the prioritization of eligible groups. Can a person choose the brand of vaccine that will be given to him or her? So the national government, based on the prioritization and scheduled delivery of the vaccine, if a certain Philippine FDA-approved brand will be delivered first, it will automatically be given to the first priority eligible group. But I would like to explain this further. It does not mean that we will force you to be vaccinated with a specific form of vaccine if you do not want to. If you belong to that priority group, then it will still be ang end po nito, meron pa rin po tayong tinatawag na informed consent na kailangan niyo pong pirmahan, and it will still be your choice to be vaccinated or not. Ang point lang po nito is that whatever vaccine is available, ito na po yung ibibigay na vaccine for the priority group. If you will not get vaccinated, then it will be given to the next priority population. And hopefully, magkaroon po tayo ng vaccine na gusto po ninyo. But yun nga po, since we are having a prioritization, it will automatically or immediately be given to those who are considered. Can a person decline vaccination? Ito po pala yung sagot. Yes, anyone may opt to decline the vaccination by signing a waiver. This is or her slot according to the prioritization of eligible groups, and the person shall be scheduled after all the priority population has been vaccinated. So make sure you obtain accurate information from the right sources so you are correctly advised and can make an informed decision before declining vaccination. So we have to make sure that talagang maaral din po natin mapapabakuna po ba tayo or hindi. Will a person receive the same brand for both doses? Yes, the answer po is yes. But for example, naturukan po kayo ng example po of a certain brand of vaccine, halimbawa po brand A, and then nagkaroon po kayo ng allergic reaction. Are we going to give you the second dose of vaccine? So the answer is no, because we already have seen that you have had an allergic reaction to the first dose. Therefore, ang gagawin po natin is we're going to wait for the time interval for the second dose to be given. We will not be giving any other brand of vaccine during that time. And if that individual is still willing to be vaccinated, after po nung time interval ng second dose, we can already give another brand of vaccine, and that will be considered again as the first dose of that vaccine. First dose po siya. Then we'll have the second dose considering the interval of that specific vaccine. I previously recovered from COVID-19. Do I still need to get vaccinated? The answer is yes. It is recommended even if you have already recovered from COVID-19. So ang isang tanong po dito, kailan po tayo magpapabakuna kapag nagka-COVID po tayo? So if a doctor has already tagged you as recovered, you can be immediately given with the first dose of the vaccine already. Okay, so itatag naman po tayo as recovered. We have completed the number of isolation days required, and 3 days prior to discharge, wala na pong symptoms. Clear of symptoms na po ang patient natin. Do I need to get tested before getting vaccinated? So the answer is very clear. We do not need to get tested for RT-PCR or even antigen test before getting the vaccine. What is important is we undergo the appropriate health screening for us to check if you are eligible or not. So what do I do during vaccination? So there is an assigned vaccination site for you. Please be there as scheduled. Wear your face mask, face shield, and stay at least 1 meter away from others. So we still have to observe minimum public health standard. Sign the informed consent signifying that you are aware of the benefits and risks of the vaccine and is willing to get vaccinated. And on the day of the vaccination, as I mentioned earlier, you will be monitored post-vaccination for 30 minutes to 1 hour to check if you have any unusual symptoms or adverse events. So all vaccinated Filipinos will be monitored for 12 months after they get their shot. Again, yung AEFI po na tinatawag natin, it will be monitored strictly by health professionals. If, for example, there is a need to hospitalize, then the existing PhilHealth case rates for AEFIs will be used. And during master listing and profiling, PhilHealth will provide registration desks on site. So what do I do after vaccination? So after ko po mabakunahan, meron po ako mga naramdaman na symptoms. So ano po ba yung mga usual symptoms that you may experience? So first is pain at the injection site. You may also have redness and swelling on the injection site, as well as flu-like symptoms. Fever, cough, colds, joint pain, body pain. So yun mga normal po na mararamdaman po natin. These are normal signs that your body is building up protection. So but if the discomfort is worsening or increasing after 24 hours and it is worrying you, you can report to the nearest health authority for appropriate management. So the health authorities will investigate if the symptoms is caused by the vaccine or just mere coincidence. Ito yung tinatawag po nating causality assessment, wherein i-check natin if the symptoms that you're experiencing is still caused by the vaccine or is really caused by the vaccine. And most COVID-19 vaccines offer protection after 2 doses. So even if you got your first dose, you still have to be careful. So you have to complete the second dose even if nagkaroon po kayo ng symptoms sa first dose, unless serious serious adverse events po ito. Kapag minor adverse events, you will still have to have your second dose in order for you to get protection, unless a healthcare worker tells you not to get a second shot. Now, after vaccination, can I go back to not wearing face masks and face shields? The answer is very clear. The answer is no, because we know that COVID-19 vaccine is just another added layer of protection. So you still have to maintain the minimum public health standard. We can be safer from the threats of COVID-19 transmission and its variants. So I just would like to share this Swiss cheese respiratory virus pandemic defense. So as we can see here, there are different layers of protection. Multiple layers will improve the success of preventing transmission. We have our personal responsibilities and our shared responsibilities. Vaccines, nasa dulo lang po siya, no? It is just one layer of protection. So just like a Swiss cheese na meron pong mga butas, each of the interventions has their disadvantages. So meron po siyang mga butas wherein pwede pa rin po tayong pasukan ng virus. But if we use the multiple layer of protection, then we still be able to protect ourselves, our families, and our community. So the answer po is no. You cannot go back to not wearing face mask immediately. So how do we continuously protect our families? We protect our families by getting ourselves vaccinated and getting our immediate families vaccinated. Ayan, I urge everyone po to recommend the vaccine to others outside of our immediate families as well in order for us to have the herd immunity earlier. And last, how do I ensure the vaccines I get are authentic? Only COVID-19 vaccines with Philippine FDA certification and are transported under strict cold chain conditions are able to provide full protection for those who are vaccinated. So una po, let's check if it's FDA certified. Pangalawa, our healthcare workers has to ensure that transportation are maintained under strict cold chain conditions. So nakakalungkot po that some of our vaccines are put to waste because of improper cold chain management. So we have to make sure of that in order for us to get the full protection from the vaccine. So for our vaccine distribution, we see here for our cold storage facility, example po yung ating Sinovac and AstraZeneca, which only requires 2 to 8 degrees Celsius. So from the vaccine supplier, it will be delivered to our DOH private warehouse, and then to the regional warehouse, then to our provincial and city health offices, to our rural health units, and to the different hospitals and implementing units, then to the patient. Well, for those which requires lower temperature, -70, yung ating ultra-low freezer, from the vaccine distributor using a rented private warehouse to a rented private warehouse or directly to our RHUs or CHUs, hospitals, and implementing units to our recipient. The reason why the national government is asking us to vaccinate within 5 days upon receipt is for us to really ensure that the cold chain is strictly maintained. So let me end this presentation by sharing this video by Dr. Anna Ong Lim, our pediatric infectious expert.
Marami nagsasabi, alam na nila ang mga sagot ukol sa bakuna laban sa COVID-19. Ngunit kadalasan, may mga impormasyong dapat eksperto lamang ang ating paniniwalaan, lalong-lalo na kung ito ay usaping pangkalusugan. Bilang isang doktor at infectious disease expert, nais naming ibahagi sa inyo ang 5 bagay na dapat ninyong malaman tungkol sa bakuna laban sa COVID-19. Una, ang bakuna laban sa COVID-19 ay ligtas at mabisa. Ang bakunang available sa ngayon ay hindi basta na lamang nagawa, kundi produkto ng matagal na pananaliksik ng mga sayantipiko. Mas mabilis itong naaprubahan upang agad na nating mapakinabangan at matultukan na ang pandemya ito. Ikalawa, ang bakuna laban sa COVID-19 ay libre. Hindi mo na kailangan maglabas ng pera o bumili pa. Ang gobyerno ang magbibigay ng bakuna sa bawat Pilipino. May mga pribadong sektor at kumpanya na gumagawa rin ng paraan upang mabigyan ng bakuna ang kanilang mga empleyado sa pakikipagtulungan sa mga sangay ng pamahalaan. Ikatlo, ang bakuna prevensyon sa mga mayroong karamdaman. Kung kaya, ang mga may diabetes, cancer, HIV, umiinom ng maintenance o kaya may allergies, ay maaaring bakunahan basta't maayos ang kanilang kalagayan at maganda ang kanilang pakiramdam sa araw ng kanilang pagbabakuna. Ika-apat, kapag ang buong bansa ay bakunado, mas malaki ang tsansa na mas madaling masugpo ang COVID-19. Ang bakuna ay magiging panangga natin sa virus. Kung wala tayong panangga, madali tayong magagapi. Mas maraming panangga, mas protektado tayo upang hindi mahawaan at makapanghawa. Sa gerang ito, ang bakuna ang ating panangga. Ika-lima, makinig sa mga eksperto, huwag sa haka-haka. Isasalalay mo ba ang buhay mo o ng pamilya mo dahil lang sa sabi ng iyong idolo o dahil may narinig ka o nabasa ka at inakala mong totoo? Sa usaping kalusugan, dapat ay doktor at eksperto ang ating sandigan. Huwag kalimutang kumpletuhin ang tamang dosage ng bakuna. Muli, tandaan na ang bakuna laban sa COVID-19 ay ligtas, libre, lapat kahit sa may karamdaman. Magbibigay laban sa atin sa